Okay, so communication. Communication is a process of passing information and understanding from one person to the other. So, understanding is very important. If you are communicating to someone and the person do not understand, it means there will be no proper feedback. So, with communication, you must make sure that, one, you consider the information you are passing on, and also consider the understanding that the information you are passing comes with. Communication is exchange of information. Communication means transfer, transmission, or exchange of knowledge, beliefs, and attitude from one person to the other. So, effective communication is very, very essential in community health nursing, and for that matter, nursing as a whole. With communication as nurses, we must always make sure that we use it as a tool in giving care to our patients. The many problems that nurses encounter on the ward is the wrongful use of the communication tool. Some people are believed to talk to the patients anyhow. They do not conform and adjust themselves to any of the communication principles, and so they do not know who is an elderly person, who is a youth, and who is a child. They talk to all manner of persons the same way they will talk to a child, the same way they talk to an elderly person. They do not add titles to people who deserve to have titles, and all of those are challenges that comes with communication so far as nurses are concerned. And so as student nurses, you must always make sure that you will use the communication tool effectively to enhance your patients and their recovery. If you use the communication tool and use it very well, you are able to even solve most of the health problems of the patient 50% before medication is given. We most of the times complicate the patient's condition with our communication. How we even talk to the patient makes them depressed. The patient will be taking all the expensive medications, but once the person's psychological mindset is impaired, nothing works. And so we must always make sure that we prepare the patient psychologically. We must always make sure that the patients who are under our care are giving respect, as we spoke about, under ethical principles. Some of the communication processes include speaking, listening, reading, writing, observation, and the likes. Factors to consider during communication. The channel of communication must be clear and known by all whom it may concern. So, for example, in your class like this, I'm sure you have a common WhatsApp page. Okay, so before you set up a WhatsApp page, you must make sure that all people in the class are using smartphones. If people are not using smartphones, it means that other information or vital information that you put out on the page, you also send them through SMS. Otherwise, you are not conforming to the process of communication, because you are communicating to others and not communicating to another section of the class, because it is not everybody who is on WhatsApp. So in communication, you must make sure that the channel of communication is known by all. Every member must be reached by some channel of communication. Line of communication must be as direct as possible, with no ambiguity. If you are talking about vital signs, you must make sure that it is strictly vital signs and not considering other issues, just to confuse the issues. The communicator should be highly skilled in the act of communication. So we will know how a communicator must communicate to people at every point in time. Line of communication should constantly be kept open. Every communication must be documented for future references. That is why nurses, we always talk about documentation. If you didn't document, you didn't do. So always make sure that you document whatever you do on the patient. So if I go to 37 right now, the only evidence that you went there in April 2019 is that you have documented something in the nurse's notes, and then you have written your initials by it. That is the only evidence that I would use to know that you have performed something on the patient in some time past. So documentation is very, very important in communication. Objectives of communication: to develop understanding and information among all workers. If you want to prevent rumors and half-truths, you have to make sure that there is effective communication among workers. Otherwise, this one will say this and that one will say that, always bringing confusion. You always must set the record straight among workers using communication. And as student nurses, you must always make sure that you don't keep your patients in the dark. You educate them on the signs and symptoms, complications, medications, and the need to get rest and sleep, and everything that is associated with the condition that will make the person recover faster. You must make sure you communicate to them on that. To foster good attitude, this is necessary for motivation, cooperation, and job satisfaction. So you have to foster good attitude. If your patient did something that commends or needs commendation, you have to commend the person. If the person is doing something that is not correct, wrong, you have to know how to go about in telling the person and bringing the person back on track. You do not resort to shouting and insults and maligning the person just to feel bad. You have to discourage misinformation, ambiguity, and rumors. You have to, objective of communication is also to improve relationship. Okay, so types of communication. We have oral communication, we have written communication, we have non-verbal communication. So we will take one after the other. So oral communication is the use of words as to exchange ideas and information. So what I'm doing is oral communication. I'm using words to exchange ideas and information. Spoken messages usually have immediate feedback. So if you are engaging one-on-one with someone, immediately the person talks, you talk back, you give feedback. So there is an immediate feedback with oral communication. It is most effective when settling a dispute among people or two parties. Of course, you cannot use written communication in settling disputes. So if you are settling dispute between two individuals, you let this one write. The person, one person is in Kumasi, the other person is in Accra. The one in Kumasi writes to you and texts through WhatsApp, and then the other person also writes to you and sends it through WhatsApp, and then you read, and then you text to them individually that they should smoke peace pipe. Do you think the peace pipe will really be smoked? No. If they are face to face, this one talk, the other one talk, face to face, oral communication. By the time they leave, everybody might have cleared his or her chest, and then they will be living in peace, all things being equal. So oral communication is the best tool in dispute resolution. What advantages of oral communication? It is direct, simple, time-saving, and least expensive. You don't require much. All you need, as I stand here, is only 2 balls of banku. You can talk for 3 hours, 4 hours. That's all. Direct and simple. Least expensive among all the means of communication. It gives immediate feedback. I have said that once you are engaging in one-on-one, face-to-face, this one gives, that one gives, and then everybody gets the understanding before you leave. Avoid delay in sending information. This person doesn't go to think about it before he or she sends the information. Even sometimes with written communication through WhatsApp, today's modern technology, you can send someone message and the person is busy. You send it in the morning, the person reads it in the evening. You don't get feedback quickly. But with oral communication, you get your information very promptly. It ensures good relationship. As I've said, it's the best tool for dispute resolution. So it ensures good relationship. Misconceptions are cleared easily. So if you don't understand anything, you can ask them quickly. You'll be sorted out. Disadvantages. Distortions of information can occur. So as I am talking, I will say something that I mean one way, and then you'll be thinking I mean the other way. So at the end of the day, you may leave the classroom thinking you have understood what I'm saying, but you did not. So I will be able to know you did not understand what I said in examination. Most of the times, it is when you are reading student script in examination that you realize that no, they did not understand what you were saying. So in oral communication, because you talk continuously and do not stop, most of the times you mean one way and the listeners take you for the other way. So distortions occur a lot in oral communication. There's no formal records. If I do not hand over slides to you after this class, nobody knows that I have come to stand here to talk. But now that we are doing virtual class and we are on record, of course we will have formal records. But if you were in a class, the normal sense of a class, and then I was talking with our slides, there will be no formal records. Ineffective, distant, and lengthy communication. Sometimes in oral communication, you tend to do a lot of digressions. You do a lot of digressions. So you are talking about something else, A, and then you tend to talk about something else just to make sure you explain what you are talking about or the main thing you are talking about very well. So in oral communication, you tend to do a lot of digression, which makes the whole communication very lengthy. Receiver may misinterpret the message, as I've said earlier. Different meaning may be conveyed by the sender. Different meaning may be little opportunity to reflect on what is said. Written communication. This includes letters, faxes, memoranda, reports, new releases, tables, diagrams, policy manual, job descriptions, charts, graphs. Written communication provides proof that the information was exchanged. So it's a very formal way of communication. Very formal way of communication, because there is always an evidence of what you communicated from one person to the other. Advantages: serve as evidence of events and proceedings. It is used for future references. Reduce misunderstanding, because even if something is said and you do not understand, you will have the opportunity to read over and think about before you move on to the next. Many people can be contacted at the same time, especially when you are using WhatsApp. You can, with a click of a button, you can text it to about 1,000 people at a time. And written communication is very reliable and accurate. With the disadvantages, immediate feedback may not always be possible. As I have said, if the information that you have written does not get to the destination, the person doesn't get to respond. If the person reads and it's even annoying, the person decides not to respond. Most of the times, with a written communication, if the channel, there is a disruption in the channel of communication it doesn't get to the person doesn't get to respond. So more time is spent on thinking and writing, especially with the written communication. It's very, very technical. If you haven't gone to school and you can't read and write, you cannot engage in this form of communication. So it's a little bit biased. Feedback is not immediate, of course. It leads to excessive formality in personal relations. So most of the times as nurses, you must make sure you put everything on paper. If you find yourself in a hospital, working in a hospital, and then you don't have gloves, don't just use by word of mouth to go and tell the administration that you don't have gloves. Before you go there, you have written it on paper, formally reporting to them that you don't have gloves. If you don't put things on paper, they don't take you serious. Okay, you have to put it on paper, sign as the word in charge, and go telling them that you do not have gloves. And the evidence are there. So one day, if anybody comes to the hospital and then you do not have gloves, and then the person comes to meet the situation, you just tell them that you have made formal call on the administration that the gloves are not there, and the letters will be there to bail you out. But if you always use oral communication, which is very informal, in a formal institution, you will not be taken seriously, and always you find yourself wanting. It also leads to excessive formality in personal relations. If you are with your friend, and then you are always using written communication, it makes communication between you and the friend very boring, especially when upcoming student nurses, which I know most of you are engaging yourself in activities of the dark that you all know. If you are having a boyfriend and always the boyfriend is WhatsApping you and don't call you, you have never heard his voice in about 2 months. you realize that you'll be very worried. You will also be thinking whether the guy is having problems in buying credit. Written communication comes with a lot of formality. So if you want to engage people on formal grounds, you engage in written communication. But on an informal grounds, especially when you want to engage a friend on a casual basis, you use oral communication. Right. So non-verbal communication, this is a form of communication without words. It is use of gestures, facial expression, body movement or position is very, very important. As a good communicator and a nurse, you must always make sure that you look out for facial expression. Facial expression helps you to know patients who are in pain and patients who are not. Okay, non-verbal communication is very strong and therefore more believable than verbal communication. Okay, can you imagine a patient who is telling you that he is in pain, he is in a severe pain, and you tell the patient to read the pain, the patient says it's 10/10, and yet the person is laughing to scorn. It means that the person's gestures is not supporting what the person is saying orally. And you must always make sure that you look out for the non-verbal communication more. But as a good communicator, you must always blend the two, oral communication and non-verbal communication. It gives you a firm decision to make. Good communicators combine both, though. Non-verbal communication can add emphasis and depth to spoken words and can even tell you whether or not a speaker must be believed. Components of communication. We have 6 components: sender, message, channel, receiver, interpretation, and feedback. Sender is the person sending the information. I am the one sending the information, so I'm the sender. The message is what I am saying and the slides. The channel is through internet, or it is through WhatsApp, or it is through your mails, internet for that matter. And then you are on the other side receiving the information are the receiver. When you receive the information, you will interpret the information to your own understanding and then you give a feedback. So most of the times in the classroom setting, the sender is the lecturer. The message is what the lecturer is saying. The channel is through face-to-face interaction. Receiver is the class or the listeners or the students. Then you interpret and then give the lecturer a feedback through sitting for examination, asking questions, and also other means of assessment. Right. So barriers to effective communication. Barriers to effective communication. Background of the receiver. The background of the receiver is very, very important. If you compromise on the background of the receiver, the information that is being churned out can also be compromised. So, as I stand in front of you as student nurses, today when I came to the classroom and I said we are coming to talk about loamy soil, you will be thinking, loamy soil, what does it have in relation with nursing? Loamy soil. Say, did you say loamy soil? What does it have with nursing? But, of course, I have considered your background that you want to be nurses and you are student nurses. And so, loamy soil doesn't have any relation with your course. And so today when I came here, I am talking about communication and how to use communication as a tool to your patients. So I have considered you as receiver, your background. So if I stood in front of you and then I start talking about rocks and the fact that we have types of rocks, metamorphosed rocks and then igneous rocks and sedimentary rocks, you'll be wondering the benefit it has to your background as student nurses. So every communication you must take into consideration the background of the receiver. You must also take into consideration the appearance of the sender. As a sender, as I stood here, if I have blinks on my face and with an earring and a cap and my trouser is below and as I'm even talking, I'm talking and bobbing, you will lose focus on what I am saying and be concentrating on my antics. So the appearance of the sender is very, very important. As a communicator, you must appear in a very, very simple and smart way as possible as a communicator. Appearance is very, very important. Noisy environment can also be a barrier to communication. You must always make sure that the environment in which you are engaging an individual is free from noise as much as possible. Even when we are in the classroom and the track is passing, you realize that the class has to be on hold before after the track has passed, and then we'll continue. So can you imagine if this classroom, our classroom, St. Carol, was located at Circle, where someone will shout, yes, phone, and the other is also selling more money? You realize that the environment is very chaotic and nothing can go on so far as learning is concerned. So in choosing even a site for a school, St. Carol really considered a noise-free environment and brought us to here, where we are, where there is a limited number of noise. We also have semantic barrier. There are some people that before they say something useful, they have used several words that are very, very useless. As a matter of fact, in as much as we have the person use certain words, instead of going straight to the point, the person tend to be using semantics. It is very, very typical of a man who doesn't know what to say in front of a lady and start going by how many number of dogs you have in your house and whether your mother is a male or female. I wonder if any mother is a male, and start asking useless questions, quote unquote. So semantic barrier can also disrupt communication. You have to be pinpointing. You must go straight to the point. Feedback barrier. If the person doesn't present a feedback, communication is incomplete. You do not know whether the person has received the message or not. Cultural barrier. You must always make sure that you will hold on to values and norms. So the way and how you will communicate to your peers, if you are 20 years, the way and how you communicate to your other colleagues that are 20 is not the same way that you communicate to a group of mothers who have called you to come and give health education. And the least age among them is 45, and then you go and stand there and be talking as if you are talking to your peers. As a good communicator, you must always use culture, norms, values in communication. You have to always make sure that you will communicate formally when you are communicating with people who are older than you. You must always make sure that and when you are talking to your peers too, you can be using the jargons as much as possible in order not to sound boring. If you are talking to your peers and you are also going so formal, you'll be sounding boring. You must be using the way and how they will understand and get your vibe. So as a good communicator, you must always make sure that you are using norms and values. If you fail to do that, means that you will experience cultural barrier. Perception. With perception, you must always make sure you go along with the communicator. You do not go in front of the communicator. So before the communicator will talk, you have already perceived what the communicator is about to say. When you do that, you lose the track of the communicator. You must always make sure you go along with the communicator, not in front of the communicator nor below the communicator. You must move with the communicator. You must not perceive before the communicator talks. You must always empty your mind when you are listening so that you'll be able to understand what the person is saying. And after the person is done talking, you will juxtapose with what you know already. Sender credibility. The sender credibility is very, very, very important. If the credibility of the sender is in doubt, you do not tend to believe or even treat the message with any respect or value. You do not put any value on the message when the sender credibility is in doubt, especially when you have a nurse who has always been lying about the care. The person doesn't give medication. The person do charge free and say they have given medication. When you come and take up from such a person, you really doubt whether the person has given the medication or not giving the medication. If a nurse is known to be someone who has been doing the vital signs charge free, you really doubt whether the person has really done the vital signs or not done the vital signs. So sender credibility is very, very important. Emotional distraction of the receiver. You know, there are some times that the sender will say certain words that you, the receiver on the other side, may not take it lightly. But as receivers, you must always make sure you manage your emotions in order not to lose the information that the sender is trying to give you. If you try to be emotional during a communication, you tend to lose essential portion of the communication, and you do not get abreast with the issues. Especially when someone is sharing a very touching story, and then as a receiver you break into tears. Whilst you are crying, there are some portions of the information that you lose. Or there are some portion of the communication may sound very, very funny, and then you burst into laughter. Whilst laughing, the communicator is also moving on, and then you tend to lose some of the information. So you have to always balance yourself in between the two, not to be emotionally disturbed, nor to be so much overwhelmed with the situations. Language difference can also be a barrier. Language difference can also be a barrier. If I stood here and I started saying Kasana Nankana and nobody understands, I will be engaging in an exercise in futility. Okay, so language barrier, we must always use a common language that everybody understands, especially when you are sending an information to someone. You must always consider the language that the person understands. Bad listening skills. Some people do not listen. Sometimes some people, the only difference between those who are doing well in terms of academics and those who are not doing well in terms of academics is that is the listening skills. Some people is not that when they do not know, they know but they do not listen. So you stand in front of the class and tell them to go this way, and then they go that way, and then at the end of the day they fail. It is not as if they are not good students, but they fail to listen. And we will talk about how to listen effectively. So communication skills. The communication skills include listening skills, speaking skills, reading skills, writing skills, and probing skills. Listening skills. Listening is one of the primary means of receiving information. One problem with listening is that when you miss something or forget about part of a message you heard, you cannot replay the message. Good listening habit leads to understanding and good relationship with each other. So listening is very important. How do you listen? Guidelines to effective listening. Listening requires full attention of the speaker. Do not preoccupy your mind with something else. You know, so as you are watching this video, you have to make sure that you have emptied your mind. You have emptied your mind with the stress coronavirus is coming with, and with the stress that the home is coming with, and then listen with utmost attention. You have to listen for feelings in the message, content, respond positively. You have to listen and follow the part that the communicator tends to emphasize. You need to also gather certain emphasis on the part that the communicator is emphasizing. You have to ask questions for further clarification. Okay, the one means of ensuring that students are listening is asking questions. There are some people who have stood in the class for so long a time and they are almost finishing school. They have never asked a question, not even a single one of them. And I wonder whether you are listening. One means of assessing effective listening is asking questions for clarification. Avoid outside interference and interruption during communication. So there are noises outside and the people passing, you have to blind your eyes on all of them and then concentrate on the communicator and whatever the person is saying. Do not be prejudicial. You don't have to conclude before the communicator concludes. You must conclude with the communicator. Value the message. You must put the value on the message before the message can get absorbed in you. That is why I always say that if you doubt the sender credibility, it is a barrier of communication. So if the sender who is giving the message credibility is in doubt, it means that whatever the person is saying will be in doubt, and you don't get to absorb the information that the person is saying. And so you must put value on the message by avoiding sender credibility as much as possible. Do not jump into conclusion before the message is over. Summarize and restate the message to confirm what you need. That is an effective way of listening. Speaking skills can be excellent way to transmit information. Speaking also come into play as part of being a good listener. You provide feedback by letting the speaker know you understand, by offering advice and asking for details. Guidelines for speaking skills. Make an effort to improve your speaking skills. Learn to speak in a direct, confident, friendly, and conversational manner. So when you are speaking, you must go direct. You must not be meandering ways and be adding certain things that are not very useful to enhance understanding. You must sound confident. Most of you are not confident. Even though you may know your stuff, but you must still be confident. Sometimes you may be saying some things that are wrong, but because of how you are saying it confidently, people don't get to realize. As a good communicator, you must be confident. And don't hide behind confidence and channel misinformation. In as much as you must be confident, you must also be veracious. You must always make sure whatever you are saying is the truth. And you must be friendly. You must not be so much strict with a straight face and be talking and not adding anything that is jovial to the communication. You must be friendly and engage in a conversational manner. Tete-a-tete. Person says and then you also say. Use appropriate gestures in speaking. So whilst you are talking, you are also adding gestures in order to ensure that the receivers are also following. You have to vary your tone and the rate of your speech. Even if someone is sleeping and then you vary your tone, you go low and then go up. When you shout a little, the person will come to his or her senses and then open the eyes. Yes, so you have to vary your tone in communication. Pronounce every word distinctly and loud enough to be heard by the receiver or your audience. Your speaking skills will tell how inspired, enthusiastic, bored, tired, irritated, or indifferent you are about what you are saying. Good speaking skill can enhance your professional life as a nurse and a health educator. Reading skills. Reading is one of the important means of obtaining information because it allows one to control the flow of information. Most of us do not like reading. And it is also unfortunately said that if you want to hide something from the black man, put it into writing. Don't be a victim. You have to be reading. Don't let anything be hidden from you because it has been put into writing. A good student is one who reads. And so you must read as students. And you must have a good and effective reading skill, which we are coming to talk about. Reading allows you to skip over materials you do not need. Reading allows people to broaden their knowledge and get better understanding of received information. So as I have stood here and talked about ethical principles and codes in nursing, and then we have also spoken about communication, if you go and sit down and read further, you will understand clearly what I'm trying to trumpet home. As a student nurse, reading will enable you to gain course-related knowledge to enhance academic performance. Writing skills. Writing skills are important for creating and communicating information. It provides physical record of communication that can be used as proof of, if necessary. The nurse needs good writing skills to write her report on activities done on monthly, quarterly, half year, and end of year and sent to her immediate supervisor. Clearly written message help to control semantic, perception barriers. A well-written communication avoids misunderstanding and misinterpretation. Guideline for written communication. You keep words simple. Some people like using big words that unfortunately they can't spell, and on top of it all, they do not understand. They use it contextually wrong, and then the most annoying thing is that when you are marking to, the word is wrongly spelled. So you must use words you can spell one and the word you understand. So you must use simple words as much as you can. Correct usage of vocabulary and grammar. Some of you, your grammar doesn't follow any grammatical principles. Why? Because you do not read. You must make reading an attitude in order to enhance your vocabulary, one, and also your grammar. Be concise, be specific, pinpointing. Okay, be very specific as much as possible, and avoid credibility gaps. In writing, I always say that even in writing an examination, the way to avoid credibility gap in writing an essay is that if we have question 1, 2, 3, and it is question 3 that you can answer very well, you have to answer question 3 first, and then question 2, and then question 1. You must make sure that you have written the examination with some credibility. So if any examiner pick your paper, and then question 3 is the one that you answered first, and you had 18/20, the person goes into marking question 2 with a similar perception that, oh, this student is doing well. And so maybe ordinarily you might have gotten 10/20, but because the person is coming from 18/20, the person may even consider giving you a 12/20 or something. So even in examination, you must write with some credibility. The one you can do first, followed by the one you can do averagely, and the one you cannot do at all, in that manner, just to have some credibility in answering questions. Right. 6 C's of communication. There should be clarity. It should be complete. So you don't write any vague statement. You must write a sentence and complete it with all the details. It must be concise, consistent, correct, and courteous, using culture. Okay, so guideline for effective communication. Message must be clear, brief, and concise, as I've said earlier. Sense of timing. You must always know that as a communicator, you are time-bound, and you must work within the time that you are giving. Integrity must pass through right channel to get to intended audience. Take receiver's interest into account. So the interest of the receiver is very, very important, as I've said earlier. Mode of delivery, avoid negative statements. You must always make sure that the information that you are churning out, you do not try to malign people or malign your receivers. Use proper feedback methods. Communication must be comprehensive, i.e. must be very understanding. Benefit of communication skill to the nurse. Why as nurses we must use communication as a tool in dealing with our patients. It helps identify the individual needs. Of course, communication will help you know your patient's problems. It is an integral part of nursing. It can make you accepted or rejected based on how you talk. It can make you, even patients will accept you or reject you. Sometimes there are some nurses, immediately they come on duty, all the patients are quiet. Everybody doesn't talk. But when some other nurse is on duty, everybody is freely engaging with the other because you have created a tiger in you. So, as a good communicator, you must use your communication, your oration, to ensure that you are accepted. It is used in health promotion and education. Of course, we use communication as a tool of promoting health and educating people on health. It helps determine the level of knowledge of community members with regards to health. Now that we are in the corona season, we are using communication as a tool very, very much. It helps to establish good relationship between community leaders, individuals, and community at large. So it is only communication that will help members of the community to cooperate hand in hand. That is that with communication. I encourage you to use the communication tool to educate your patients on COVID-19. Use communication as a tool to educate patients on the ward on COVID-19. When we meet again, I will look at that. Thank you.